I'm talking today with Dr. Arlin Brown, who was a psychiatrist for 34 years. But Arlin, you became a homeopath as well. What led you to add homeopathy to your medical practice?
Well, about halfway through my practice in the late 80s, I became aware that my patients weren't fully benefiting from what I was doing. For example, the two main modalities that we used in psychiatry at that time were psychotherapy and medication. Psychotherapy had the problem of really demanding a lot of the patient in terms of time and effort, and many people just didn't want to go through that. The medications had the problem of being expensive, and in addition, there's the problem of side effects. And both modalities would have incomplete responses many times. So I started reading some books on homeopathy, and my wife and I also went to a homeopath to see what the treatment was like, and we both benefited both emotionally and physically. So I decided to pursue it further and did.
Now the Bach Flower remedies, although I like to call them a type of homeopathy, are not considered classical homeopathy. How did you find out about them, and what led you to add those to your practice?
Well, I was taking a course at the Hahnemann College of Homeopathy, and in the process of that course, the Bach Flower remedies came up in discussions. We tried to talk about other modalities that people might encounter when you're treating people homeopathically, other things that might be useful, how they might interfere with homeopathy or they might be beneficial. And we also had people in the class who had experience using Bach Flower remedies, particularly rescue remedy. And so that's how I learned about it.
And what did you notice when you introduced it into your practice and your patients?
Well, I used rescue remedy for my patients when they would suffer acute problems of a psychological nature. For example, someone might have a panic attack when you were treating them with a remedy, particularly when you're starting a remedy early on. And you don't want them doing something that's going to interfere with the action of the remedy. And the rescue remedy wouldn't do that. This was one of the real values of it. It was gentle, yet powerful. And so it was very useful. And unlike some of the medications that are used for panic attacks that can become addicting, this wasn't of that nature. In fact, it's something that you basically use just for crises that people might have. It's not, if someone needs further treatment, whether homeopathically or with Bach Flower remedies, you try to go with a longer type of approach to treating them.
And so you found that they complemented each other well then in that respect?
Yeah, it did not interfere with the action of the remedy and tended to be effective most of the time.
That's excellent.
And it didn't have side effects.
It did not have side effects. Right.
People tolerated it well.
Yes, that's certainly been my experience as well, and helped sort of pave the way for them to adapt to a new situation and a new state of health.
Yes, what would happen is when they would take the remedy, they would become more grounded and have more clarity about the situation and be better able to apply themselves to solving the problem that they had.
Well, that is excellent. I'm glad that you had such a good experience, and particularly I'm happy for your patients that they had such a beneficial experience. Thank you for sharing those experiences with us.
You're welcome.